everybody. It is Sharia, Integrated Marketing Specialist here at Radio 1 Raleigh. And thanks for tuning in. March is Women's History Month, and we're so excited to bring you Her Story, a celebration of Black women. And today we have Bahby Banks, the CEO and Principal Research Consultant. Okay, welcome, Bahby. I am super excited to have you here with us. I want to say Dr. Bahby, but out of class, I'll respect what you requested and say Bahby Banks. How are you? And welcome.
or Dot's child, whatever you want to call me is fine. I'm good. Happy Wednesday. I don't even know what day it is, but thank you for the opportunity just to talk a little bit about our work. I'm excited.
Wonderful. Thank you so much for being here with us. And just to launch and start this off and tell everybody about the celebration of you and what you're doing in the community, could you let us know what inspired you to create this COVID-19 digital campaign? And I have a teddy bear story. So if you're in, tell us a little bit more about that.
So I come from a long legacy of servants, nurses. My mom was a nurse. Her mom was a nurse. My great-grandmother was a nurse. And so I spent most of my childhood in the community. Even though we were in the military, my mom was very active. I was out there doing blood pressure screening and had my stethoscope on. And so the teddy bear story is, it's an exemplar of my mom just meeting a need, right? She was a nurse in the recovery room. I don't know if you've ever had surgery, but if you come out of anesthesia, you're like, what planet am I on, right? And so she noticed with the kids coming out of anesthesia that they were really terrified. And so my mom put together a little brochure, just like think of a blank sheet of paper folded on itself. And she asked me to make a teddy bear for the kids to color in on the last page. Now look, my skills were and are garbage when it comes to that. But my mom put together this beautiful pamphlet on this sea green paper. And, you know, I was the final page where I got to draw a teddy bear. Now, here we are 20, 30 years later, probably closer to 30. And I saw that picture of my mom, and she modeled with a young patient what she was doing on this pamphlet. It just reminded me, like, you don't have to wait on other people. I'm sure there were tons of people before my mama got there, probably tons after, but my mom saw it as an opportunity to, like, hey, let's show these young kids what to expect. And so that's exactly what we did with this campaign, right? And so we saw COVID-19 coming down the pike. I've been in health equity work for decades, and I don't know if you understand or the audience understands systems and structures, but they have been created to keep folks at the bottom, right? And there's plenty of policy and research to back that up. And so we knew with COVID coming down the pike, who was going to be most disproportionately affected? Black and brown people, Latino people, rural people, right? Because the system's operating exactly as it's designed. And so you think about this teddy bear, right? And so I'm a creative. I'm always thinking about, I'm an acronym queen, sister. I'm like, ooh, this could be
like that.
Wow, right? So we did Not a Host, which is NA that I could share about if I could share the full campaign, but that's why we saw a need for like culturally relevant, engaging content and said, you know, we can create something. So I pulled together the folks I know who are brilliant: epidemiology, psychology, racial healing and trauma, community advocates. And we worked very hard on this, and it's gained huge momentum. We're excited about it.
Well, I'm happy to hear that. And as you said, being a creative and being able to step outside on your faith, that's really amazing to see that you created something good that speaks to our community. So you actually have a background in epidemiology. So tell us what led you to do the work you're doing and how in health communications.
Right. So epidemiology, hopefully the world understands what we do now. We don't study skin, right? So
you might need to let them know.
Right? We study disease and population. So all these charts and tables you're seeing on the news or on articles or on social media, these are likely epidemiologists or people who study statistics or biostatistics who do this work. What I noticed as I was training in this, Shariah, was like, what do we do after we collect these numbers?
Okay.
Right? So at what point do we shake and move and start thinking about policies or interventions so that these numbers don't look like this over time? And so ultimately, my training is anchored in that, but I wanted more creative engagement with community, even as part of my training. And so how do we translate this data and this information that folks are seeing into actual like calls to action? And how can we be creative, right? How can we really think about how to nudge at people based on what we see out in the media world? Like, what can we anchor on and use as calls to action? So that's the bridge that, one of the bridges that the Not a Host campaign bridges. So at a foundational piece, it's like, well, what is a host, right?
Right.
We all know the person who's like, hey, I'm through, I got 50 people. Okay, nope, we're in the middle of a pandemic. How about that? So look, if you can just, for a minute, just hold off on hosting, that's what we're asking you to do. Or if the recommendations are a handful of people still 6 feet apart, please do that. The other piece of the Not a Host campaign anchors back to that basic science and biology we all learned in high school and college, if you decided to do that. Viruses, and I know you see this on social media, right? Viruses gone virus. They're looking for time, opportunity, and a beating heartbeat. That's what they're looking for. They're looking for a host or a teacher. And so we wanted to do a play on words between the host hosting these events and the host that you could be for this virus. And you might have symptoms or you might not. Right. So when science say asymptomatic, know that you can be walking around without a fever, a temperature, a cough, a rash, or a muscle ache and still have the virus. So now that has an opportunity, right, to be creative and to connect those dots from folks are watching day after day after day, more COVID cases, more hospitalizations, more deaths. Okay, let's pivot and think about some messaging so that people can understand. We understand this is a system issue and systems need to be corrected so that we don't see these disparities. In the meantime, in between time, these are things that y'all can do to really lower your risk of getting COVID. So short answer to what you said, it's like, how do we make this plain, right? I'm a red light, green light person. Like, you could, all the letters behind my name are cute. But look, when I go to the auto shop or I go to a restaurant, give me red light, green light. I don't have time to explain the whole anatomy of it. Like, just tell me red light, green light. So this is like a red light, green light type of campaign. Okay.
And so how can people get involved with the Keep It Right campaign? How can we get our people engaged?
That's a good question. So what we love about the whole Not a Host campaign, and I need to give a huge shout out to my team. Team. The Blood, Sweat, and Tears team. We're there, volunteers, we working it. We have interns from UNCG, from Elon. I have former students. I'm an adjunct professor at UNC. I have former students who have come on. I have friends and colleagues from FAMU, BU, HIJK, LMNP who like review the content to make sure that it's relevant. So what we saw with the Not a Host campaign, and I know we only have a few minutes. So folks, go to the website, notahost.com, and check it out. But what we wanted to be very intentional about was like, the educational piece is important, right? This one direction, like, wait, wear your mask, test what tracing looks like. The other piece that we saw would be important is to engage people, right? Everyone's sitting at home looking a little cockeyed, unless they are an essential worker and they don't really have an option or choice. That is their job. They have to go out because they are essential workers. But how can we still leverage this digital space, right? We know the Facebook demographic, 25 to 64, are on there doing everything. They're playing with the kids on TikTok. Everybody's on social media right now. So how can we also bridge this one-way educational piece with engagement, right? And so Keep It Right part of the campaign is an opportunity for everybody to send in videos, content to show folks how they're doing what they're supposed to do in the pandemic, right? And so Keeping It Right is anchored in 3 different things. They could keep it virtual, like you and I are doing. We could go to the studio, but we're in the middle of a pandemic, correct? So keep it virtual is one thing. Like, if you can't do happy hour, try to do it virtually if you can. The other piece is keep it simple, right? What we know in disadvantaged communities, historically marginalized, oppressed communities, is that they're often multi-generational homes, meaning you have probably an essential worker that has children that also has elders in the home that they have to take care of, right? it might not be possible.
Right.
And so the other thing is trying to keep it simple. All right, so look, you got to look at the same folks around here every day, all day. Try not to invite in another 25 people, right? So these are things you could do at home to keep it simple. You got stuff around the house, you making recipes, clothes, or whatever. Hey, share with this community how you are keeping it simple in your home. How are you keeping folks engaged so that you're not throw folks out like we saw on Fresh Prince of Bel-Air with Jazz, right?
Boot them out.
That's one of my favorite memes. And the third one is keep it solo, right? We know that community is important as people of color. Community is so important. But it's also okay to be solo. If you need to be out real fast and go for a walk, you can. You want to go fishing? You can. And so this is an opportunity for the community, particularly if you're a business owner, a small business owner, to say, hey, these are some things we're doing at home that other folks can do. We'll fully spotlight you across social media. Folks will have an opportunity to engage with you while we're still reinforcing these behaviors, right? To keep it right. And so folks can go to the website. It's notahost.com / the slash that goes this way, right? Like that. Engage or share. Either one of those will take you. Put in all your social media handles. Let us know what you do. Reach back out and start spotlighting you.
That's awesome. So for you, and how can people upload their own pictures? Because you just said that we upload them. So we go to the website to notahost.com / or /.
It's the slash goes this, like if you look this way. So if you're typing it out, it's the slash that's going towards the right side of your screen if you're facing it, not the left side. Don't go back to the www part. Go back
to the other side. Okay.
I want to call it a forward slash in my mind, but I feel like people call it a backslash. To me, it's going forward.
It's forward. I believe it's forward / yes. So who is supporting this work, and how can others support the campaign, Not a Host campaign?
The whole community. So you mentioned uploading photos, right? We kicked off this entire campaign with Facebook frames. And what we know is that if you are on Facebook and you're in that Facebook demographic before the young kids got off and saw it there, that's when we get awareness about a lot of stuff, right? Breast cancer, domestic violence, ALS challenges. So literally the community went to the Facebook social media page. Easy click, put the frame on and picture. I'm sure you've seen me like, and so anybody can upload a picture directly from Facebook. If you're not technologically savvy, you can go directly to our website and a member of our team will do it for you. We got like little Keebler elves everywhere, right? And so if you have a photo, a simple headshot, if you want to make it goofy or you want to be with your family, you upload the photo on that same notahost.com share. Shoot us the photo. It goes directly to our Dropbox. We frame it and kick it back to you. So that's one way.
That's wonderful.
Right? And we
super easy. Yeah.
We kicked off right before the holiday weekend around Thanksgiving, right? We had no idea. It was funny. We were just like, is this what people feel like when they put out an album? Like, you have no idea how it will be receptive, right? So you've talked to different sectors of the community and they're like, oh, this is dope. You should totally do it. And so we have a concept video as well. If you go to the website, we let that rip right before Thanksgiving. So we had Thanksgiving, Good Friday, the whole weekend, eat and shop, Cyber Monday, and like Facebook frames out the wazoo across social media. And we were like, we got a message. The concept video was like 75,000 views. We like, we got a message. So that's number one, the community, right?
They respond.
If you're not technologically savvy, we can do it for you. You can join the Facebook page, Instagram page, Twitter page. That's community. You can also upload what's called your why video, right? So right now, like folks are kind of just being slung around to work, slung around to school. So we want to hear from people like, what's your why? Why are you engaging in the behaviors you should to lower COVID risk? And so you'll see on that same share page that folks can. So my why is I'm doing what I'm supposed to so I can go outside and play. Like, I'm ready to hug people. I would like to go play some drums. That's what I want to do. Other folks are like, you know what I mean? Other folks are like, I'm tired of dressing up just to go from my kitchen to my living room. So that's another opportunity. And then we have generous people. Like, when we started sharing this with folks, they were like, how can I donate? And we were like,
we didn't prepare for that.
Right? So you'll see at the top of the website, there's a donate button that is specifically to help push this campaign for the next 9, hopefully not 12, but the next 9 months. And so that goes to Pillar Consulting to help support this digital campaign, and our team. There are people working very hard in content creation, instructional design, video, like you name it. And then we had support. We were super excited to receive a Facebook small business grant earlier this year. Ma'am.
Congratulations.
Ma'am.
Congratulations.
The girl that drew the little teddy bear, right?
Yes.
Right. And so we received that. And then we got support from the Maya Angelou Center over at Wake Forest University as well to support our print campaign. And so these were 2 initial investments that were a big surprise to us, but the doors are open either for individual contributions, or if organizations are interested, we have several opportunities to sow into this work, to donate.
And look, it just came full circle for you, it sounds like. So,
right? Yeah.
You know, as you said, just stepping out and doing what you need to do to make it the impact. And as you said, you don't need anyone else to do it for you.
Mm-hmm.
You can. And look what happened. You got sponsors and everything out the world for this. And as I'd love to see too, as a community, definitely engage with you. So you are truly appreciated, of course, for coming here today to share this message, so that way we can continue this outreach and make sure that we spread the word of not a host. You know what I'm saying? And get this started. So so thank you so much, Bahby. So for everyone who tuned in, if you missed anything, please be sure to go to our website and click on the Her Story link on the top of our page. Then also be sure to share it with a friend. And for more information on Not a Host, please visit the website at www.notahost.com. I'm not going to throw the / to throw us off, but we know we can go there and do everything we need to do. And thank you again, Bahby. And thank each and every one of you for your continued support for our platforms and this amazing initiative.
Thank you. Thank you. I appreciate the opportunity. So thank you for the opportunity to come back and talk a little bit more about my story. And hopefully you are inspired to create and craft and walk in your story, specifically as we're thinking about this pandemic. So we get a month, I'm not mad at it, to celebrate all of our contributions to this nation, to this world. But we know we work 365 days. The same as Black History Month, we work in 365 days. And so I'm happy to come here as a Black woman business owner to share a little bit more about decision-making. Right? Specifically in the midst of a global pandemic, had a lot of people ask me questions, and it anchors back for me of a journey of thinking for myself, doing for myself, and exploring who I am for myself. And I work with people from middle school all the way up to corporate people. And there are 3 words that I challenge them to think about as part of their life and their journey, their story. And those 3 words are, according to whom? Very simple question. And I don't mean it in a way of, being resistant or questioning or challenging, although I think that's kind of how we get to discover who we are. So think about all of the things you were told, particularly as a woman. And I don't know how much you experienced, but, girls don't do this, or women don't do that, or you may not have ever seen a woman do something. According to whom? Who told us this information? According to whom? And that, to me, you can overlay in every aspect of your life. According to whom? And for me, if you can't tie it back to someone that I can figure out if it kind of syncs or jives with me, then I question it. And I really think for myself how to make the best decision as part of my vision, as part of me envisioning who I want to be in this life, my story. And I hope you do the same for your story. And so let's talk about what this looks like in the midst of a global pandemic, right? We have a lot of different information being thrown at us. I'm going to walk you through some steps that have helped me in my life. What also inspired me to create an entire movement called Envision Empowerment Experience, and how the same nuts and bolts that we put together for this movement and vision, completely you can overlay to some of the decision making that you have for you, yourself, your family, your loved ones. And so I want to completely honor and recognize the pain and frustration, the hopelessness and helplessness that people have felt. That's real. And acknowledging that and navigating your way out of that is also very important. Thinking about your mental and emotional health. Let's talk about according to whom. I'm going to teach you some secrets today from the research world. So I'm a researcher by training. I also do this Envision leadership work. I'm going to give you nuggets from both. Here we go. The first thing is according to whom. So I pulled up a couple tabs here. I'm going to go through. When you see an article or a headline or something along those lines, don't fall for the okie doke. Think for yourself. According to whom. So that's the first thing. So I pulled up an article here that says, there was certain reactions around the vaccine. Okay, I'm going to click it. First thing I'm thinking is, all right, who wrote this? Was it Kiki or Billy or whoever? The first thing I want to know is, who is the voice? Who is the voice behind this information? And so I clicked. And I saw that the writer of this particular article is someone who has a background in English literature. I'm not mad at all. Looks like she's a great writer. She's had an opportunity to write in a lot of different places. Okay. Does she have the credentials to give information about vaccines and clinical trials? Okay, so that's the first thing. Who is giving this information? This wonderful, brilliant woman has a background in English literature. Okay, that's the first thing I want you to think about. Who is the voice behind this information? All right, I'm not passing judgment. Looks like she's a good writer. Perhaps she has written in other places and spaces. That's cool. Second thing I want you to think about is, are they a credible source? I want you to spend 5 minutes going through different information around COVID-19, tracking, tracing, vaccine hesitancy, equity, racism, all of these things. And I want you to think if folks are credible in thinking about this information. Prime example for me is Dr. Kizzy. That's a bad sister. That is a bad sister. And so for me, I want to see that, hey, she got trained in virology. She's been studying this particular method for the vaccine for 6 years. And I just go back and say, okay, she can probably speak on viruses. I can lean my credibility towards her as opposed to someone else that just popped up and has a quick headline that said, oh, 25,000 adverse. Okay, let me check you out and see who you are. No judgment, but you work in the financing industry. And I can't speak to financing because that's not what I study. So that's not even a knock on you. It's just credibility. So first thing is, who is the voice? Second thing is, are they really credible to give you this information? The second thing, and it's going to help you in everything in your life, filtering out noise. Is this a headline or is this factual information? Right? Is this a quick snippet because viruses are going to viruses and media is going to media, right? That's what we do. So really think about, is this information helpful or is it a hindrance? Could this be a part of my decision making? Or is this some noise that I have to continue to sift through? And what will streamline you to that place is the first two things that I tell you: who's the voice and are they credible, right? And so really thinking through this factual information. And I'm calling you to a higher level, ladies, because we are brilliant. And then I want you to overlay it on, if this was in the regular world and nothing else was going on, what would we take away from this? I'll give you a quick example. So back in December, there was a headline that 4 people got Bell's palsy from the corona vaccine. This is completely factual information. Somebody tracked down 4 Cool, let me check it out. Out of how many total people? That's your higher level of thinking. It was out of 40,000 people. So that's literally a 0.01% chance. That's still a chance. Let's be real. So next thing I want you to think about, okay, so if I was walking around in 2018, 2019 before the pandemic, what is my likelihood of getting that same thing? And Bell's palsy is just kind of like paralysis of the muscles in your face, right? Do a quick Google search of that information and you find out same likelihood, 0.01%. So this is what you think is part of your informed decision making. Same thing in life. Don't just give me the top level of information. Give me the whole thing. So you said 4 people. Okay, let me scan this. 4 out of 40,000, 0.01. All right. General population, exclusive of all of this other stuff going on, 0.01. So what you say, brilliant woman, as part of your decision making in your journey, is whether I'm in this study or whether I'm in the population outside of all this, I have an equal chance of developing Bell's palsy. So this is a quick thing to help people because they're like, I don't know where to get the best information. First nugget I'm giving you right now is ask bigger questions. So this number out of how many? And then let me check in the real population. All right. Last thing is trust science. I have a biology degree. I study epidemiology and biostatistics. I studied those because I love numbers, I love math, I love science. Science is not really like some abstract thing like, oh, it could be maybe. No, we all have an immune system and they pretty much kick out things the same way. We just have different immune systems. So what I say as a joke is that my middle brother has the powerhouse immune system. He has no allergies, no asthma, no nothing. I and my oldest brother, April come around, we need help to get through our season of immunity. And so what you have to think about is, all right, so viruses have been here for 800 years or longer. Viruses go virus. So let's think about what has been done scientifically way back and what we're doing now, what developments have been made now. That's hard though, right? Because this may not have been something you studied. So that circles back to finding the right people who are credible with information. You can find this centralized information where we're bringing in these experts, right? And you should ask questions. This is your life. This is your story. This is your journey. And so I ask for, as we continue to go through this pandemic, that you continue to ask those questions, right? According to whom? And who is the voice behind this? And is this factual information? And let me check real quick and make sure that I fully understand what's going on. If you don't have it at the top of your head, I encourage you to come to Not a Host Space and learn from the experts from all around about how to make the best decision for yourself. This is all about, for me, vision. A lot of folks are asking, like, how do you keep your energy up? I see the other side of this, and I don't know whether it'll be tomorrow or next month or next year. But my vision is that I'm going to continue to make the best decisions for myself. And I'm going to encourage people to do the same exact thing. So thank you for the opportunity to come back and share more as part of my story. And I hope I provided some helpful information as you think through your health, mentally, emotionally, and physically as part of your story. Thank you.